So today we are going to study about the carcinoma of esophagus. Okay, carcinoma is relatively rare in Caucasians, but it's more common in Iran, Africa, and China. 200 per 1 lakh people. Squamous cell can occur in any part of the esophagus, and almost all the tumors in the upper esophagus are squamous. Adenocarcinomas arise in the lower one-third of esophagus from Barrett's esophagus or from the cardiostomach. Incidence is increasing, is now approximately 5 in 1 lakh in UK, and is possibly because of high prevalence of GERD and Barrett's esophagus in Western population. Despite modern treatment, the overall survival of 5 years survival rate of the patient presenting with esophageal cancer is only 13%. So what are the clinical features? There will be progressive painless dysphagia for solid foods. There will be weight loss, chest pain, hoarseness suggesting mediastinal invasion, fistulation between the esophagus and trachea or the bronchia. Bronchial tree leads to coughing after swallowing. Pneumonia, pleurophurin, physical signs may be absent even in the initial presentation. Cachexia, cervical lymph neuropathy, or other evidence of metastatic spread is common. So for the investigations, we'll do endoscopy with biopsy, then barium swallow to demonstrate the site and length of the stricture, but adds little useful information. Then we can do CT scan combined with PET scan and should be carried out to identify metastatic disease. This is adenocarcinoma of the lower esophagus. This is the tumor, adenocarcinoma in association with Barrett's esophagus. Over here, PET scan and CT scan is combined, and whole body PET scan showing a vid uptake in the primary tumor, this black arrow, thick arrow, but also in distant paratracheal superior thin arrow and gastroesophageal inferior thin arrow lymph nodes. So these are the two lymph nodes. Okay, we can also do endoscopy to determine the depth of penetration of the tumor into the esophageal wall. So what will be the management? We'll do potentially curative surgery, and we can follow that with chemotherapy. Although squamous cell carcinomas are radiosensitive to radiotherapy, alone is associated with a 5-year survival rate of only 5%, but combined with chemotherapy for these tumors, it can achieve 5-year survival rate of 25%. So surgery, chemo, and radiotherapy for squamous cell carcinomas, and then we'll have to do palliative care. For example, you can do laser therapy and metallic